Welcome to our first boost. We are so excited to have Dr. Simone Wildes with us. She and I are unmuted at this time, but if you are joining in, just momentarily, we will get started. Want every opportunity to jump on. You're muted right now, but when we get to the Q&A piece of our conversation, we will unmute you if you have a question. Just some logistics. If you go down to the bottom of your Zoom window, you will see that you have a reaction icon. If you have a question when we get to the Q&A section, or you have a reaction to something that we've said, either virtually raise your hand or virtually give us a thumbs up, and we will come right to you and unmute you so that you can ask your question, and we can interact like that. So we only have a short amount of time, so we're going to jump directly to Dr. Wildes. I just wanted to introduce you to Dr. Wildes, who is an infectious disease doctor at South Shore Hospital for the past 13 years. So we're really grateful to South Shore Health for always being such a great supporter of ours and connecting us with Simone. Dr. Wildes did both her fellowship and residency in Philadelphia and graduated from Loma Linda University School of Medicine in California. She's made appearances on Good Morning America and 2020 to speak about the pandemic of COVID-19. Dr. Wildes is on the front lines battling COVID-19 and seeing patients at South Shore Hospital. And she's also a wife and mother of two daughters aged 8 and 10 years old and lives locally in our community. What's funny, Dr. Wildes and I had a conversation prior to jumping on this, and I just want to remind you that we have lots of little coworkers and big coworkers with us at home. So if something happens and an animal pops through our screen, or a human, just know that we'll get right back to speaking with you. Technology too has been a little spotty, so we'll jump right back to it. But you know, we're all in the boat together. So, Dr. Wildes, welcome.
Thank you so much for having me. I'm delighted.
Thank you for the work that you are doing at South Shore Hospital. I know today's a day at home caring for your family. But we're grateful that you return to the hospital and take care of so many. So thank you.
Oh, thank you.
Tell us about what's happening with treatments right now. I feel that people are overloaded with COVID information, but what about what's happening with treatments?
So there's a lot of information floating around about treatment. One thing is do not have any definitive treatment for COVID-19 at this time. You'll be hearing a lot about Plaquenil and azithromycin as treatment options, but we have not really done a lot of randomized controlled studies to say that these are definitive treatment options for COVID-19. There's also other antiviral medication. You might have heard of remdesivir, but that has not been fully studied yet. So bottom line is there are a lot of different options that are being floated in the media, in the medical community, but we're still doing studies. So I think for right now, we're doing the best we can, but we don't have any definitive therapy.
Okay. So lots of unknowns. What should we do if someone in our own home has the virus or has symptoms of the virus, or you even suspect, because you can be asymptomatic as well?
Okay.
What should we do?
Great question. So I should reassure you that majority of the cases are mild. So that's 80% of cases with coronavirus infections is mild. So what that means is if you have the virus, you're best served being at home. You take care of it as you would if you have the flu. You rest, you hydrate, and then you take fever relieving medications like acetaminophen, the supportive therapy that you would do at home. Now, again, wash your hands I can't stress that enough, that you need to keep washing your hands. And if there's someone there in your home who has it or you suspect, I recommend that you isolate them to one bedroom, one bathroom. Don't try to have them mingling as much. I know you want to bond, but this might not be the time to be bonding because you could also get the infection as well. So minimize your interaction with that family member at this time.
What about people that are entering your home? You find it really critical, you're a single parent, you have to go to work, you have a trusted babysitter. How should you interact with new people that are entering your home?
So if the babysitter comes in, you want to at least have a discussion with the babysitter to tell her that you would like her to limit her interactions with the outside community, because if she has it and brings it into your home, then of course everybody else is going to get it. So I would say have a discussion with her and also encourage her as much as possible to practice social distancing. You know, I know it's hard at home with the children. Keep washing your hands, keep cleaning the high-touch surfaces. I would say that definitely would be something that's helpful. If you're talking about delivery options for food, one of the things we encourage is what's called contactless delivery, where they just deliver the food at the door. You don't have to see them. They leave it and you can pay electronically. So there are many different ways in which we can.
And I heard that when they deliver and you receive it and it's in a container, you should transfer it from the container to the to your own bowls and plates and
Yes, yes. So that's definitely something that we have been recommending. And the reason is because we found that the virus can survive on these different surfaces. So with the plastic, we know it can survive for 72 hours. Cardboard, it's 24 hours. So when you get the food, you dump those containers and you use your own containers. That way you minimize the transfer of the virus into your home. One thing I need to also stress is that there has been no studies that show that the virus actually lives on the food. So you can eat the food, but you know, the containers you toss.
Okay. What if you go to the store and you try to get hand sanitizer and there's none left? I understand that there are some recipes. Should we make our own hand sanitizer?
I think right now we might have to make our own because there really isn't none. But what I want to encourage everyone to do is soap and water. So don't forget how important it is to use soap and water. I know we're all on the go and we sometimes need the hand sanitizer, but soap and water is very effective. The coronavirus itself, it's very fragile, and when you use the soap, it actually breaks it down quite quickly. And so washing, and you wash for more than 20 seconds, destroys the virus. So it's a very effective way of killing the virus. Now, if you're going to make your own, make sure you follow the guidelines, because not all the alcoholic content is enough to destroy the virus.
Okay.
So there's some recipes online that, you know, you can look at the cocktail.
Yeah. After this boost call, we will send out an email with some additional resources. The Nebraska Medical Center, who's famous for their biocontainment unit, has a recipe there as well. Vodka does not work. I just want to be very clear that that actually only has 30 to 45% alcohol. So follow the recipe, as Dr. Wildes says. So summer is coming up. Two things. One, can it be transmitted by mosquitoes? And two, because of the heat of the summer, will we see an extreme drop and then an increase when it gets colder in the fall?
So I'll do the first question first with regards to mosquitoes, and there is no evidence to show that, the mosquito is a carrier. So we don't have to worry about that. So we're thankful for that. Now, the second question is whether or not with the summer, we're going to see a decrease in the cases. To be honest, I don't think we really have a clear answer for that right now, because we don't know how heat affects the virus. So in the summer, we might actually still have more cases, and in the fall, we're definitely expecting more cases. So unfortunately, we don't have any clear answers for that question.
Again, a lot of unknowns. Is it transmitted by or through pets and animals?
So no evidence, the CDC said recently, no evidence that it's transmitted by pets. There was a case in New York with a tiger in the zoo that they found that had COVID-19. With regards to our pets, we can still keep our pets. However, if you are sick, I would encourage you not to spend as much close time with your pets. So no sleeping with the pets or cuddling with the pets. You're going to treat the pet just as you would any members of your family that has the virus, but they themselves do not actually transmit the virus or get the infection.
Okay. One of the essential things that that some of us have to do is go to the grocery store, and also to put gas in our cars to travel to work. What are some ways that we can keep ourselves safe?
Okay, so let's start with the gas station. So we all know the gas pumps are like some of the filthiest things that we have to deal with on a day-to-day basis. And we have to fill our cars with gas. So how are we going to do it to minimize the risk for ourselves? There are a number of different things that people talk about, but I also like to be practical. People are like with gloves and with paper towels. I mean, the list could go on. What I do recommend is when you go, I am a little what I touch, so I might use a paper towel to do it. Some people like gloves. Bottom line, when you are done, I think at this point it would really be good to have a hand sanitizer, because you might not have access to soap and water at that time. So after you're done, make sure you clean your hands before you get back into your car. So that's the gas station. And then once you get home, go wash your hands thoroughly with soap and water. With regards to the grocery store, first thing is we have now new recommendations that you need to wear a mask when you go out. The CDC came out with those recommendations on April the 3rd, that you wear a cloth mask. And if you don't have a mask, you can wear a scarf or bandanas. So if you're going to the grocery store, you're going to need to use that. And the main reason for doing that is because we have asymptomatic transmission. So they've found that about 25% of the population, they're transmitting the virus and don't even have any symptoms. So we want to make sure that if you are in that population, you're not transmitting the virus to others. Next thing is social distancing. So again, social distancing is we try to practice being 6 feet apart from others. It can be hard grocery shopping, but I think if you try to find times when it's not as crowded. So I know they have the elderly population going early in the morning. I don't think a lot of people are going to go that early, but I think as soon as the elderly are done, you might try to go, or later in the day. When you go to the grocery store, try to have a list. So you know exactly what you're going for, you pick up the things that's needed, and you also pick up enough for at least 2 weeks so you don't make constant trips back and forth. That, of course, minimize your exposure. And of course, when you go, I don't want you to buy all the toilet paper, right? So just get enough that you need, but you can get extra water. So, just have a list, get the things you need. Once you're done with your grocery store shopping, when you come home, make sure you wash your hands, you wipe off the products that you've had with the disinfectant wipes, and the fruits and vegetables, you wash them with water, put them away. But I think if you do all of that, that will minimize the spread of the disease.
Okay, great. We have a little less than 15 minutes left in our boost this afternoon. So I just want to make sure everybody has a chance to ask the questions that are most pressing for you right now. How are you feeling? Do you have a question? Give us a thumbs up or a virtual hands up. I'll come right to you. Kathy, I'm going to come to you and unmute you. Please go ahead. What is your question?
Thanks, Jen. Thanks for taking my question. And my question is, what is the typical length of time if somebody is even mildly symptomatic that, people are experiencing from a timeline perspective? And then what might be some of the symptoms of somebody that's experiencing COVID?
Thank you. Great question.
Thank you.
The incubation period is, we have it as 5 to 14 days. So I can just tell you that with the flu, it's normally pretty quick. So it's 1 to 4 days for the flu. With the coronavirus, it's as long as 14 days. So that's definitely a long span of time that we normally wouldn't see if you had the flu. Now, common question about the symptoms. So there are a number of different things that I want to make sure we stress. Fevers, you get pretty high fevers. You have a cough, you get shortness of breath. You can also have some GI symptoms like nausea, vomiting, and some diarrhea. You have body aches. One of the very unique things that we have been finding with the coronavirus is patients report a loss of taste and smell. So a lot of times when people say, I've lost my taste and smell, it gives us as clinicians a clue to anticipate that this person might be in the stages of developing coronavirus.
Thank you. Does someone else have a question? And we'll go right to you. I've heard a lot that obviously our elders are most at risk, but our kids and our smokers, vapors, people that are smoking other substances, are they at risk, and why would that be?
Okay. So let's start with the children first. So children, they do get the disease, but it's very mild. So they do not have the same effects as the elderly population. And when I talk about elderly, I'm referring to people greater than 60. So children do get it, but they're usually mild asymptomatic. The elderly population, most of them usually have underlying medical conditions, such as heart disease, diabetes, lung disease. And so with that and being elderly, they tend to get a more severe form of the illness. And so we're definitely more concerned about them because they have the underlying conditions, which makes them higher risk and makes us more cautious about taking care of them. With regards to smokers, there is some damage to the lung. So we have found that with the coronavirus, one of the issues that comes up commonly is people with it get severe pneumonia. So you can imagine if you have underlying damage to your lung and you get an inflammation infection on top of that, then things are definitely going to be more severe. Vaping affects the lungs in so many different ways. So vaping and the COVID-19 just doesn't go together very well. The outcome is usually pretty severe in the patients. And even though we talk a lot about the elderly population being the highest risk, we do see it happening in younger population too. And so we need to encourage our teenagers, young adults, to make sure that they practice the same precautions that we are telling the elderly, like social distancing, staying home if you are ill. We want to encourage them to practice that too, because they're not invincible.
Yes. All right, our next question is from Shital. I'm trying to find you. And your question is, how about a child having underlying issue like asthma? Would they be equally vulnerable?
I would say that if you have underlying lung issues, you are definitely more vulnerable. However, the children seem to have this capacity to handle this infection a lot better than the adults. Having said that, though, if your child has bad asthma, then you want to be extra cautious and be in touch with your physician that, you know, this is what's happening. I am concerned about my child. So that's going to take a lot more contact with your pediatrician, not just, oh, the children are not going to get it, but just closer communication.
Okay, perfect. And Shitel's microphone was not working. If your microphone isn't working, please just type in the chat and I will come and find you. Sylvia, what is your question?
Hi, yes, my question is, I've been hearing that due to the virus that we should be drinking every 15 minutes to keep our throat not dry. And then I've also been hearing to be drinking warm versus cold because it helps. Is that true, or how does that work?
So unfortunately, that's a myth. We have no evidence to support that. And I've seen that floating around on the internet, people sending it on text. Sorry to break your heart, but that doesn't work. So do not try to do that at all. You know, that's not the way that we're going to prevent the virus. Mm-hmm. What we can do, social distancing, wash our hands, stay home if you're ill. And another thing I would say that would really help, by boosting your immune system by eating properly, getting enough rest, eating a healthy diet, minimizing your stress. I think those are the things that we can actually do to help ourselves to fight this infection. And of course, don't forget to exercise. You can go out and exercise even though you are home.
Yeah. I see Coach D giving it a high five there. That's right. That's right. Now, should you wear a mask while you are exercising? I read today potentially wearing a mask, and also I put on my contacts today, but for the past month and a half, I haven't been wearing it. I understand wearing glasses, or I read. I don't know if it's true. That's why I'm asking. That glasses can also help to prevent the spread. Okay.
So first thing about the mask. So when you're out, we definitely want to encourage you to wear a mask. But remember, it's a non-surgical mask and not an N95, just a cloth mask. So I would definitely encourage everyone when they go out to wear a mask, because you might be carrying the virus and don't know it, so you want to protect others. So we're just going to be conscious about our neighbors. With regards to the contacts, right now, there isn't a lot of evidence about the contacts, but what I will say is that the glasses protect your eyes. One of the ways that we get this infection is if the virus gets into your eyes, your nose, or your mouth. So I'm in the hospital and I'm always wearing my glasses, and I think it helps because it's protecting my eyes. So remember, when you do your contacts, you keep putting your hands in your eyes, and if your hands are not as clean as they need to be, you could run into some problems. So if you can get by without the contacts, I think, you should. But if you absolutely have to, then I would say just make sure you're a little bit more meticulous about washing your hands.
Okay. Also, what over-the-counter medicines can safely alleviate some symptoms? I've heard take Tylenol, don't take Tylenol, take Advil, don't take Advil.
Great question, right? This is a hot topic. So definitely Tylenol is safe. What happened with regards to the ibuprofen was the French medical team came up with some notion that, the ibuprofen tends to worsen the coronavirus. No, there isn't a lot of study to support that. In fact, the WHO initially said, yes, don't take ibuprofen, but I think since then they have retracted the statement somewhat and said, there needs to be more studies. I can tell you that people are now a little bit leery about taking ibuprofen just because of what information was sent out, and they're trying to do some studies. For the time being, I would say take Tylenol, acetaminophen. However, if that's not working, I think it's reasonable to do the ibuprofen. But just remember that caveat that information is out there, but there's not a lot of research to support it.
Okay. Any other questions? We only have a few minutes left, and just want to remind everyone that we are going to be doing these boosts every week. We actually had so many experts that wanted to jump on and share information with our great network of women that we have Wednesdays and Fridays for boosts. You'll be getting a schedule very soon, so we're super excited. In fact, I see some of those experts on the phone today. So next week, we have somebody from SCORE Boston who's going to be sharing on Wednesday any kind of loan and financial support. We also have Pam Garamone, who is going to be talking on Friday, and she's going to be sharing some critical information about happiness mindset and how to shift our thinking in a way that will relieve some anxiety. And also, we do have a mental health practitioner is going to be joining us on May 1st, and that's a Friday. So you'll get that whole list. But please, if you have an opportunity to respond back to the email that you get on a follow-up on this, let us know what topics that are really critical and important for you. It's not just about serious topic. It's also about a ton of fun topics, like how to make a recipe out of 4 ingredients that you have left in your pantry. So we want to be supportive and we want to get you the information that you need. So I just want to thank Dr. Simone Wildes again for coming and sharing your knowledge with us and your time with us at this really, really important time in our lives, and we're really grateful.
Okay, thank you for having me. And remember, be safe, practice social distancing, wash your hands. We want to get out of this real soon to get back to our new normal.
We sure do. Thank you. And thank you to South Shore Health, Angela Floro from the South Shore Conference for Women, all the women who are here from all the conferences that She's Local does and supporting our efforts. We're really grateful. Thanks everyone for coming, and we'll see you next Wednesday. Have an awesome weekend.
All right. Take care. Bye.
Take care.